Thank you for joining us today as we prepare you for your upcoming spine surgery. Providence Healthcare performs nearly 150 spine surgeries a month, and as a system, we have worked together to ensure excellent outcomes and an exceptional experience. Welcome to your journey. We as Providence St. Joseph's Health are happy to be a part of your journey and have created this class to not only help you and your family feel more prepared for surgery, but also give you the information needed to promote a smooth recovery. As you can see, our agenda will help take you through all the stages of your journey, from preparing preoperatively, the short time with us in the hospital, all the way through your discharge to home. It is our hope that we will be able to answer all of the questions you may have during the rest of this presentation, but should you have questions that may not have been answered, please don't hesitate to reach out to your surgeon's office. Here is the address and phone number for Inland Neurosurgery and Spine. Just in case you do not already have this information, I will leave this slide up for a few moments. The safety of our patients, our caregivers, and our communities is and will continue to be one of our top priorities. Providence St. Joseph Health has been a leader in the battle against COVID-19. Using the most up-to-date local, state, and federal protocols, we have created safety measures and processes in all of our hospitals and clinics to ensure all of our safety in the midst of the COVID-19 pandemic. Prior to your surgery, you will be required to show evidence of a negative COVID-19 swab test result. The timing of the test and the receiving of the results is very important. Your swab test will need to be performed no more than 5 days before your date of surgery, and the results of your test must be received by the pre-op department no later than 1 day before your surgery, and no sooner than 3 days before your surgery. Once your swab test has been performed, we ask that you quarantine at home until your surgery. This will help limit any unnecessary exposures prior to your surgery. Please work with your surgeon's office to schedule your testing. Twistle is an application we use to help our patients be successful when having spinal surgery. This application will provide you with information, reminders, and education at specific times during your surgery journey. It can be used through an app on your smartphone, by text messages, on your computer browser, or even through regular phone calls with recorded voice messages. You will receive an invitation to Twistle from your surgeon's office once your surgery has been scheduled. Having someone available to assist you during this journey will be very helpful. You should find a family member or a friend who will be your care coach. You should familiarize them with how you might need some gentle assistance as you recover. As you'll see, you will be pretty functional when you go home from the hospital. You most likely won't need this care coach 24 hours a day, but you may need them for driving or assistance with other tasks that might be physically challenging. If you have pets at home, find someone who is able to care for them for the first week or two after surgery. If you are unable to have them out of the house, please make sure to wash your hands after petting or handling them to reduce the risk of you getting an infection. It is important to prepare your home for your return from the hospital. Make sure your home is stocked with food and you have some meals prepared in advance that only require heating. Make sure you have a firm, straight-back chair with armrests available. It should be tall enough that it is easy to stand up from a sitting position. In addition, make sure your home is free from clutter and consider placing night lights throughout the house so you can safely walk in the dark. When you get home, things may become trip hazards that were not trip hazards before. These items might be electrical cords, debris, or throw rugs. Consider having your care coach watch your pets outside the home, as they may also pose a tripping hazard. If you have throw rugs in your home, please remove them, as they may cause a fall while you are recovering. If you have area rugs, use double-sided tape to help keep the edges and corners secured. Also, make sure your stairs and pathways are clear from clutter so that you have lots of space to move about your home. When you come in for your surgery, please make sure you bring your picture ID as well as your most up-to-date insurance cards. Also bring the emergency contact information for any family or friends you would like for us to have on file. Please bring any paperwork or tests your physician or surgeon has given to you in preparation for surgery. These items might include EKGs, test results, or order slips. If you don't have any, no worries. All necessary information needed for surgery is typically forwarded in advance. It is very important you bring a list of all medications as well as the doses that you take. Please be sure to include any over-the-counter medications or supplements. And, unless instructed, do not bring your medications with you to your surgery. If you have an advance directive, please be sure to share this with the staff so they can make sure it is saved in your medical record. Also, if you have a blood donor card, please bring it with you. If you don't have one, no problem. The staff will type and cross-match your blood should there be a need for this. If you were fitted for a brace to wear after surgery, please make sure you bring this with you to the hospital. Unless requested prior to surgery, please do not bring any assistive devices such as canes or walkers. Our staff will make sure you have access to any devices you need while in our care, and will help arrange any devices or equipment that you will need to use at home. When you go home, you will want to wear loose-fitting clothing that will be easy to get on and off. You will also want comfortable shoes and socks, preferably something that has a full heel to ensure your safety. If you use a CPAP or BiPAP, please make sure to bring it and let the staff know. The staff will check the device so that you can use it to help you be comfortable while you sleep. If you wear glasses or hearing aids, or if you have dentures, please bring them with you and make sure that you notify the staff. Please bring any cases that you have for these items so that they may be safely stored when not in use. And last but not least, if you have a cell phone or tablet that you plan on using while you're in the hospital, please make sure that you bring the charger too. It is very important we have an up-to-date list of your medication. Please make sure to tell your surgeon all of the prescribed and over-the-counter medications, as well as any herbs or supplements you take. Either your surgeon or the pre-admit clinic will explain to you when and how you should take your medications leading up to surgery, as well as during your recovery. Be sure you understand and follow all instructions regarding your medications prior to surgery. If you have any questions as to what you should or should not be taking, and it is not clear in the instructions you have received, please call your surgeon's office for guidance. We take infection prevention very seriously, and you are an important member of our infection prevention team in preparing for your procedure. Cleaning your skin gently before surgery can reduce the risk of infection. We ask that you shower the night before, as well as the day of your surgery. Your surgeon will most likely ask you to use a specific soap. This soap, as well as detailed instructions on how to use it, will be provided to you. When showering the night of your surgery, it is also important that you use clean towels, sheets, and pajamas for the night as an extra precaution to prevent infection. You will receive a phone call for registration and intake within a week of your surgery. They will ask you a few simple questions and will provide further instructions such as when to arrive to check in on the day of surgery. Most patients will be seen in the pre-admit clinic prior to going to the hospital. The purpose of this clinic is to do an in-depth review of your medical history to ensure there are no contraindications for you having your spinal surgery. They will also review all of your medications and will provide specific printed instructions on how to take your medications leading up to your procedure. The provider at this clinic may consult with other healthcare experts such as anesthesia or cardiology. They may also reach out to other medical specialists that you are currently seeing or have seen in the past to make sure there is nothing additional that would prevent you from having a safe surgery. Let's talk about the day of surgery. Please be sure you have followed any instruction regarding your morning medications that you have been asked to take, and be sure you have followed all eating and drinking instructions. Additionally, please make sure you have removed all jewelry, including any body piercings, prior to coming in for your procedure. You should have already been pre-registered over the phone, so on the day of your surgery, you will go directly to the surgery center waiting room to be checked in. Your surgeon's office should have provided you with a map and instructions on where to go to check in. If you have any questions about your check-in time or where you need to go, please contact your surgeon's office for instructions. Once you have been checked in, you'll be taken to your preoperative room. One friend or family member can accompany you during this time. The nurse will have you undress and put on a hospital gown. Then they will take your temperature, pulse, blood pressure, and oxygen levels. They will also start an IV and may give you some medications prior to your surgery. While in the preoperative room, an anesthesia provider and your surgeon will meet with you to discuss your surgery plan. They can answer any last-minute questions you might have during this time. Your surgical site will be confirmed with you, and the area will be marked prior to going to the operating room. Your friend or family member typically can remain with you right up to the point you are taken to the operating room. Once everything has been set up for surgery, you will be wheeled into the operating room. The staff will assist you onto the table and will position you in a way that provides the surgeon the best view for the procedure. Once under anesthesia, the surgical staff will perform the usual duties to prepare you for surgery. Before you know it, your spine surgery will be done and you will be taken to the post-anesthesia care unit, or PACU as we commonly call the recovery area. In the recovery area, you will be under the watchful eye of our PACU staff as you continue to come out of anesthesia. They will closely monitor your vital signs, and once they are confident you have adequately come out of anesthesia, you will be taken to your hospital room. Your friend or family member will be directed to where they can wait while you're in surgery. Spine surgeries take 2 to 6 hours depending on which procedure is being performed. Additionally, you will spend 1 to 2 hours in the recovery room. Once your surgery is done, the surgeon or their assistant will meet with your family or friend to discuss how your surgery went. As soon as you are able to have a visitor, the surgical staff will assist them to your room. In the event your family or friend decides to leave the hospital while you are having surgery, the staff will reach out to them once your procedure is complete. Please make sure the hospital has updated contact information for them prior to the surgery. Once you are awake and alert in your recovery room, you will be sent up to one of our inpatient units. This is where you will spend the rest of your hospital stay until you are discharged home. You will see a variety of caregivers in the inpatient area. All of them are working to support your care needs. Nurses, nursing assistants, assistant nurse managers, chaplains, dietary staff, and environmental services, just to name a few. Our goal is to help you be comfortable and support you through your healing journey. Please share your ideas as well as any concerns you might have with your care team. During your hospital stay, your surgeon or their assistant will see you at least once every day. You have a call light to get the attention of the nursing staff to come in and assist you with your needs. Please utilize your call light and don't try to get out of bed yourself. For your safety, a nurse or a therapist will assist you with getting in and out of bed. Our nursing staff will come to your room hourly to check on you, to ensure your safety, and to anticipate your needs. When nurses change shift, they will meet in your room to share information about you during their change of shift report. There are communication whiteboards in every hospital room. These are used to communicate key information about you to the entire care team. Please make sure to share with the staff how you'd like to be addressed, whether it's Mr., Mrs., or if you have a nickname or preferred name you would like for us to use. Also, Make sure we have contact information for the family member or friend you would want to have information regarding your care. It is not uncommon to experience some nausea after surgery. Because of this, it is important that your diet be advanced slowly. The nursing staff will start with ice chips, will advance it to liquids, and eventually food as you are able to tolerate it. We will adjust diets based on your individual needs and the direction offered by the medical team. If you have any special dietary requests, please let the nursing team know and they will be able to guide you on how best to meet your request. There are a variety of tubes and lines that you may have when undergoing spine surgery. Most of the time, these are only present for the first day or two after surgery. Your medical team will give you instructions as to when these can be removed. You will be asked many times during your journey to rate your pain on the pain scale. It is important that we have an objective way to find out how you are doing. On the number scale, 0 is no pain and 10 is the worst possible pain you can imagine. Since everyone tolerates pain differently, the medical team will ask for your personal tolerable level of pain. We use your tolerable level as our guide to know when to give you pain medication. Our goal is to try to keep you under the tolerable level of pain so you can rest comfortably and also tolerate activity. It is important that you are able to get up and move as quickly as you are able. Once again, our goal is tolerable pain, not 0 pain. We don't want you so medicated that you cannot stay awake and participate in therapy. Over the years, we have learned that although opioid pain medication can help with pain, they have a number of common side effects. These include things like nausea, dizziness, low blood pressure, constipation, drowsiness, respiratory depression, and even dependency and addiction. Because of this, we have instituted a multimodal approach for pain management. This is a fancy way of saying that we will use a variety of approaches to help you manage your pain. This could include using ice packs, repositioning or frequent movement, acetaminophen, anti-inflammatory medication, nerve pain medication, and lastly, opioid pain medications. It is best if you take your medication before it gets beyond your tolerable level of pain. Studies show that patients who take small doses of pain medication early, rather than waiting for the pain to get out of control, typically end up taking less pain medication overall. You are an important member of the team when it comes to managing your pain. If you have ideas on how to manage your pain, or if your pain is not being adequately controlled, please be sure to share this with your care team. While most people don't want to talk about it, constipation can be a real issue after having surgery. Anesthesia, pain medication, lowered mobility, and not having eaten for almost a day can all contribute to your bowels wanting to rest, which can lead to constipation. There are some easy ways to help avoid this. Drink lots of fluids, get up and move as soon as you can after surgery, and once you are able to eat, make sure your diet contains fiber in every meal. It can take a few days to get back to your normal bowel routine. At the hospital, your nurse will offer you a stool softener twice a day, every day, and a laxative or suppository before going home if this is needed. Once home, you should still be aware of this, as this problem can persist for a while until you are fully off of pain medication and back to your regular mobility. It is important to continue to follow this plan once you get home as well. Due to the trauma of surgery and the early inactivity that comes along with this, there's the chance of developing a blood clot after surgery. This can usually be avoided by completing the following activities. Early mobility, such as getting out of bed and moving with a caregiver. This is one of the most effective ways to prevent blood clots. While in bed, do ankle pumps 10 times every hour while you're awake. To do them, simply pump your ankles like you are pumping the brakes on a car. Lastly, the medical staff may use a compression device that will be used when you are in bed. Once again, getting mobile quickly after surgery is the most important step you can take for a speedy recovery. You should plan to get out of bed within a few hours of your surgery being completed. Staying active and performing the exercises recommended by your therapy team will be very effective at keeping you from developing a blood clot. But, just in case, let's go over some of the common signs and symptoms of blood clots. The most common form of clot usually takes place in the lower leg, and the symptoms include swelling, pain, tenderness, warmth to the touch, or the sensation of having a cramp. If you experience any of these symptoms, please contact your surgeon's office. Sometimes a clot that is formed elsewhere will work itself loose and will block the lungs, heart, or brain. If you develop chest pain, pain with deep breathing, unexplained cough, especially if the cough produces blood-tinged mucus, lightheadedness, dizziness, or any signs of a stroke, please seek immediate medical attention by calling 911. Depending on your surgery, you may see physical or occupational therapy during your stay. While these therapist roles differ, they both have the same goal of preparing you to discharge home. Listed on this slide are some of the key objectives that each therapist will focus on. Please refer to the therapy section of your spinal education booklet for more specifics on post-surgery mobility techniques and the potential equipment the therapist might recommend for you. You will have some movement restrictions while you heal. This could last for several weeks to months. Your surgeon will let you know when it is safe to return to full activity. Until you've been cleared by your surgeon, you should remember no BLTS, which means no bending, no lifting, no twisting, and limited sitting. Please review your spine education booklet for additional information about movement restrictions after surgery. There are some important considerations for when you go home. Let's start with incision care. After you get home, it is important to keep your surgical wound clean and dry. Always wash your hands before and after any dressing changes, and do not apply lotions or creams unless instructed by your surgeon. This is important to help prevent infection. Make sure you look at your incision daily. If you are unable to clearly see your incision, have a family member or friend look at it. Notify your surgeon immediately if you observe any signs of infection such as redness, swelling, or drainage, especially if the drainage is colored or has a foul odor. Showering. You may take a shower once you get home unless your surgeon tells you otherwise. However, do not submerge your incision in water until directed by your surgeon. Make sure you use fresh, clean towels and washcloths every time you bathe. Transportation. Do not drive while taking opioid pain medications or muscle relaxers. As healing varies from person to person, your surgeon's office can help decide when it is safe for you to return to driving. Traveling considerations. In most cases, the materials used in spine surgery will not set off security detectors. Ask your surgeon's office about when it is safe for you to resume extended travel. Dental work. Evidence for using antibiotics before dental procedures is mixed. Please discuss with your surgeon and your dentist if antibiotics are necessary. Upon discharge, you will receive specific instructions from your surgeon's office regarding aftercare and follow-up appointments. Please review all instructions and your educational booklet for any questions you might have. If you have a question you cannot answer after reviewing these materials, please reach out to your surgeon's office. We hope this class has been helpful in preparing you for your upcoming surgery. If there are any questions you have, or if there is any feedback on how we can make this education better, please do not hesitate to reach out to your surgeon's office. Thank you very much for trusting us here at Providence St. Joseph with your healthcare needs. We look forward to caring for you on your upcoming journey.